Episode of our live sessions with the fertility specialist. It's good to have you back. If this is your first time on the show, I want to say a big thank you for being here. And we're saying welcome to you. If you're a returning viewer or subscriber, I want to say thank you for always coming back here, for always tuning in. And would want you to click on the like button, click on the subscribe button if you are new here, click on the share button because I believe there are a lot of people who would be willing or who are ready to learn from our session today. My name is Abimajo Iliojo Grace, and I'm your anchor for today. With me live in the studio is Dr. Jane. You're welcome, ma.
Thank you, Grace, for having me.
So we'll be talking about ovulatory disorders today. On the internet, there has been an outbreak of PCOS and the likes. Like almost every young girl has PCOS. At some point, if I was trying to lose weight and the weight was not shedding, I was like, I be PCOS because they say people add weight and all of that and
Yeah.
things like that. So we'll be talking about the diagnosis, how to diagnose ovulatory disorders, what are their signs and symptoms, and what are the treatment options. Please stay tuned, stay glued to your screens, and I would also repeat that you should please share because there are a lot of people who would learn from what we have to discuss today. So, ovulatory disorders. Dr. Jane, what would you say are ovulatory disorders?
Okay. I'll start by saying that ovulation is a central event in the menstrual cycle and is also a vital or is also central in the initiation of reproduction. What is ovulation? Ovulation, I would say, is the release of eggs for every cycle a woman has. Now,
Okay.
when we want to talk of ovulatory disorders, we are talking about series of a group of disorders now, or disturbances that lead to either infrequent release of these eggs
Okay.
or abnormal release of this egg or absent release. So either you're not releasing eggs, you
It's
have
abnormal.
infrequent release or just abnormal forms. So those are ovulatory disorders. This also is a group of disorders.
Okay. So it's not just one thing, it's not just PCOS, it's a group of
Disorders.
disorders. So our next question is what are the signs and symptoms of ovulatory disorders?
Okay. Well, commonly when you talk about ovulation, when we say someone is ovulation commonly is a sign that someone has. It's when a woman is ovulating or has regular menstruation, it means that she's ovulating. It's not all women though, but a good number of women that have regular menstruation ovulate. What it
Okay.
means is that the commonest presentation of ovulatory disorders irregular menstruation.
Menstruation.
Yes. Secondly, we have women with difficulties with achieving pregnancy,
Okay.
infertility. It's a common sign. Now, in our introduction, we established that there are a group of disorders.
Yeah.
It means that if we have a lot of things causing these ovulatory disorders, then you can come with one or more symptom or sign of your condition.
Yeah.
For instance, polycystic ovary syndrome, the common one, the PCOS we all know about.
The one
Yes, you
that
will
makes people
hear.
add weight.
Yes, yeah, yes. Those women have excess weight gain. People that have a lot of male pattern of hair distribution on their body, acne, and all of that, or what we call pimples, right? The very bad ones. Then we have other conditions that can cause PCO, irregular ovulatory disorders. Like when we talk of thyroid problems, thyroid is a small organ on our necks that helps with body's activities, like our metabolic, the daily activities of our body. So it means if you have too low of the hormone or too much of the hormone, it can affect you. What about young girls that are having eating disorders, even not just the weight gain, excess weight loss is also
Okay.
can also cause ovulatory
Oh, okay.
disorder. So it's just a range. Then when we have too much prolactin, some women we have breast milk discharge when they're not breastfeeding. That's a form of it's like what we call abnormal breast milk discharge. That is also a common cause of ovulation disorder. Then we also have a wide range. People that have their ovaries failing before they get to menopause, people that have had treatment for one cancer or the other
Yeah.
by either using drugs or using special x-rays called radiotherapy. Their ovaries can fail and they're in different groups. These have been classified in different groups and their treatment also differs
This
based on the group you fall under. Yeah.
So it means the fact that my friend has PCO and she used this particular medication does not mean that because my ovulation or my menstruation has
Just
stopped, does
it
not
don't
mean I
mean that
should
you
not
have
use the same.
it doesn't mean same
Yeah.
thing. It differs for different people.
Okay. So is it so what is PCOS and how does it affect ovulation?
Okay, thank you. Polycystic ovary syndrome, that's the
What it
full
means?
name.
Yeah.
Yes, it just tells you from the name, it implies that it's a common hormonal condition in young people. And as the name implies, polycystic, it means the ovaries have
That's
tiny,
many.
small sacs containing fluids seen around the edges, and that you commonly see on ultrasound. But
Okay.
this condition, it now makes the ovaries to produce lots of male hormone, which we call androgens, and those hormones gives you some of those symptoms. That's why people with PCO, you see them with excessive hair on and acne or pimples. It affects ovulation with the excess male hormone. The excess male hormones affects um, the release of eggs, affects the growth and maturation of your eggs. And you know, when the eggs don't grow or mature, you cannot have ovulation. So basically, that is it. Excess male hormone affects ovulation by affecting the growth and maturity of the eggs, or what we call follicles.
So I've seen a couple of women that have hair on their chest and hair on their chin. Does that mean they have PCOS?
Well, commonly, that is what you would see, but there are
Okay.
some women that have excess male hormone from other conditions,
Okay.
not necessarily PCOS.
PCOS.
So there are other
Okay.
conditions
That
that
can
can give
cause that.
you what we call androgens in excess.
Okay.
Even some cancers on the kidneys, we call
Okay.
them adrenal diseases, and all of that can give you those.
Okay. Thank you very much, ma. Then beside PCOS, what other conditions can cause ovulatory dysfunctions?
Okay, so well, we have discussed this, but not in detail. So I would just want to list it based on the classes they fall under.
Okay.
So commonly, different conditions can cause ovulatory disorders. So for a woman to menstruate through the whole month, go through her cycle repeatedly, and all of that, you need a functional brain,
Okay.
you need a functional ovary, you need a uterus that is functioning, and of course the vagina that is open
Hmm.
for the menstruum to
So it's
come
like the
out.
group work.
Yes, it's a group work. So now when we have problems at the brain, like when we call them it's a problem in the brain. So this category of people have this kind of ovulatory disorders. These people with excessive weight loss, people with excessive weight gain,
Gain.
yes, people that are having problems with their thyroid gland, people that have some brain tumors, people that have some conditions that will, like people that have even seizure disorders, like what we call epilepsy in the other in conventionally. All those are categories, those that have problems with the brain, right? So not just the brain, then we now have the class of PCO. PCO
Mm.
falls. So it depends, because by the time you are doing your investigations or reviewing these women, there's a level of hormone you will see. You think it's this, you see the hormones come to this level, you say, okay, it's possibly it's PCO and all of that. Then we also have a class. When I talk about the third class, where we have failure of the ovaries, premature failure, because women after menopause don't menstruate.
Yeah.
But when you say a young girl or a woman less than 40, she stops to menstruate, those are called premature ovarian failure.
Failure.
And those categories can either be genetic, I mean, something
The
that happens
familial
to
history.
chromosomes from birth, how they are formed and all of that. Then you can have the what we call acquired.
Okay.
So those that have had surgeries, that they took out one their ovaries, of people that have had um like we mentioned, treatment for cancer, like chemotherapy, using drugs or using special x-rays called radiotherapy. Then there's also a class. Too much prolactin is also a cause of ovulatory disorder. That is on a class of its own too. So those just like a run through, even though there are a lot of other bigger causes, but these are the common things you see. Even in the first class, when I was talking about the brain, excessive stress, excessive exercise. So you see all these athletes, their exercise level is very high and all of that. It leads to also excess weight loss and all of that. They have ovulatory disorders in that category.
Thank you very much. So, how are ovulatory disorders diagnosed? What blood tests or imaging studies are used to diagnose ovulatory disorders?
Well, to make a diagnosis of ovulatory disorders, you we have established there are a lot of causes. So it
Yeah.
means that the cause for client A different
It's
from
from
client B. So it means that I have to establish what your problems are by interacting with you, what we call taking a history, then whatever I find from what I've so a woman comes in, I have breast milk discharge. She doesn't really have to have PCO, but she might not be menstruating or have irregular periods. Or someone says, I'm sweating too, I'm losing weight, I'm gaining too much weight, I feel very hot when the weather is very cold. Those are thyroid problems. So you see, so they are different. So when I establish that, we now examine the clients. So examination, we talked about excessive hair distribution for PCO. So you see a young lady with lots of hair, acne, then there's the way their hairs are distributed and all of that. Suspect. Then finally, we now go to imaging or investigations as your question. So imaging, commonly we do ultrasound scan. We'll see the typical polycystic ovaries, this appearance of those small sac-like cysts in the ovaries, around the edges of the ovaries. Then you now do your blood work, you look at their hormones. That's where you see the differences in the hormones, what we all call hormonal imbalance and all of that. Then for some persons, I mentioned some tumors in the brain can
Yeah.
affect. So you can do
An
an X-ray
imaging.
imaging of the brain, like CT and all of that. Yes, so it depends on what you find, then your investigations will be tailored in that direction.
There are times that people just use other people's experiences and come to the hospital and say, I want to do a hormonal assay. And you're wondering, okay, why did you see a doctor and all of that? So,
Yes.
based on what she said, it's important that you see a specialist. It's important that you don't just use your friend's analysis to come and say you want to do investigations.
Yes.
So, how does ovulatory dysfunction impact a woman's menstrual cycle?
Well, commonly, ovulatory disorders make you have irregular periods, and that could be a significant source of distress or worry for most young people who want to be like her friend or her sister that sees her period every month. So I think that's ovulatory disorders commonly affect your menstrual cycle by making them irregular or absent, or well, irregular means they are very few in the year. Yes.
Okay, so I've had conversations with a couple of women my age bracket or age range, and then it's most of the complaints I hear it's my period used to be 4 days, it's now 2 days. My period used to be 5 days, it's now 2 days. Is that an ovulatory related issue?
Not necessarily, right? Ovulatory disorders commonly will come with irregular or absent periods. Now, for someone to talk about number of days and duration, rather, I would establish that normal menstruation can last between 2 days to 8 days. So it means that even if my period came for 5 days last month and I see 3 days
I shouldn't be
this month,
worried.
no, you shouldn't be worried because it still falls within.
Yeah, the
But
normal
you
range.
have to look out for other symptoms. Now, what happens in the 3 days determines. So I see blood stain on day one, blood stain day two. It's very scanty. You want to look out for other causes.
Yeah.
But when you see normal flow, use same normal number of sanitary towels and all of that, might not necessarily mean anything because sometimes we are stressed, so your flow becomes significantly reduced
Reduced.
and all of that.
Thank you. So, can ovulatory disorders cause pain or other symptoms? I know you spoke about some symptoms earlier, but pain especially.
Well, I would say that ovulatory disorders cannot cause pain, not any form of pain, except pain from other conditions that you have. But
Okay.
when we are establishing ovulatory disorders, we don't talk about ovulatory disorders causing pain. Most times, in fact, a lot of women would not even know. For those that have not heard of PCOS, they might just come to the hospital, incidental finding, okay, no wonder I'm not having regular periods. Okay, this is the reason you are not. This is so you hardly have pain as you're
Pain,
presenting complaint. Commonly, what they have is inability to get pregnant,
lack
delayed
of
conception,
menstruation.
and all of that. Yeah.
Okay. So, how does ovulatory dysfunction affect fertility?
Well, anyway, once a woman is not ovulating, by that she's not releasing eggs, it means that she might not see her periods regularly. So she might not track when she's ovulating. And once you are not ovulating, you cannot get pregnant. We had established earlier that ovulation is also a central event in the initiation of reproduction.
Yeah,
So that release of those eggs, it's also like a starting point because it's the eggs that get fertilized and you get pregnant. So when it doesn't happen, chances of getting pregnant or
pregnancy.
fertility is significantly reduced. A lot of women cannot track their cycles, so you don't even know when you're ovulating. So it keeps skipping, and those are the challenges with fertility. I guess that was the question, right?
Yes, thank you, ma'am. So, what are the different treatment options for ovulatory disorders?
Well, for ovulatory disorders, we have a whole range of treatments. So your treatment will depend on the cause that your healthcare provider or the specialist seeing you suspects. So we have a whole range. We have drugs, we have lifestyle modifications, and we also have some surgical interventions. So when we talk about lifestyle, we talk about
Medication.
your diet, weight loss, very important,
Weight
as
gain
little
too.
as yes, for those that excessive weight loss. So for weight loss, weight gain is easier.
Is it?
To gain weight, I think it's easier than losing the weight. So if you at least as 5% weight loss of an individual, if you're an individual losing like as little as 5% of her weight loss of her weight rather, it's there's chances of her ovulation. She can actually it can help with ovulation.
Irregardless of the size of the weight, does it just
Yes,
apply?
at least
Let's say
yes.
I'm 100 kg and somebody
Yes,
else is 65. If we
yes.
reduce
It's
five
still
percent,
5% because if you're 100 kg, your 5% is
it's
different from
different
my
from mine.
5%.
Yes, true.
So yeah, so that goes a long way. So healthy diet, stress relief of stress, and all of that. Then we now go to drugs. Commonly, we have the range of ovulation induction drugs,
Drugs.
different varieties. Yes, a lot of them have been used. Some persons will come and say, "My friend used this one. Why didn't you give me this?" Yes, commonly all this clomiphene we have and all of that, they would help you to release eggs and all. But again, there are still other high modalities of treatment. When those drugs are not working, we can also use some special hormones, even though those are commonly used for younger people and all. Then we also have some surgical interventions like pinhole surgeries, like what we call where we can take just put a telescope through your tummy and make some puncture holes on your ovaries. That will significantly reduce the amount of male hormones that the ovaries they are releasing and help you to ovulate.
How does this happen? Is it that it will burst or
We
something?
just drill some holes on the ovaries. It's called laparoscopic ovarian drill,
Oh,
and
oh.
those things are available whenever you walk into the facilities. We'll have them done for you.
We do almost everything in Alps. I mean,
Yes, so
so how effective are these treatments? Um,
well,
when women come around, is there a guarantee, a certain level of guarantee that they would start ovulating, they would have children, infertility will be dealt with, and all of
yes.
that?
Well, these treatments are very effective. Yes, though we have some women that might be resistant to one form of treatment or the other, like the drugs and all of that. Then we now, if you are not responding to one method of treatment, we have the others where we give special hormones that we talked about
The
brain
brain.
dysfunction. It means that the brain cannot produce those hormones. Then we have those hormones we can give to you in place of what the brain is not doing. Then we
Like
talked
a
about the surgery.
replacement.
So when you don't
Mm.
respond to one method, the other method will come in handy. So ovulatory disorders are treatable, manageable, and all treatments they are mostly effective. But if you don't respond to one, we move to the next option.
And we do all of that at Alps Hospital.
Yes, we do that.
So, are there any lifestyle? Okay, you've spoken about this. You spoke about weight loss and all of that. What are the benefits and risks of fertility treatments like IVF for women with ovulatory disorders?
Well, benefits of IVF. First thing, with women with ovulatory disorders present with infertility,
Hmm.
inability to
To
conceive.
conceive.
IVF is an assisted method of achieving conception. So it means that if you have that challenge with IVF, you achieve conception, your dream of parenthood is achieved. Then it takes out the emotional stress and gives you, it also improves your, just takes out emotional stress, the anxiety, the worries, and all. But what are the
Risks.
risks? Commonly, sometimes in the treatment of ovulatory disorders, you could have some people that ovaries would respond excessively, and but with high level of expertise and experience, we have been able to what we commonly call ovarian hyperstimulation syndrome. We have been able to learn how to pick these
Manage.
symptoms in the earlier stages and manage them promptly and appropriately. So yes, that is one of the
Risk.
risk. Then also, well, in IVF treatments, multiple births are very possible. Yes, but we will not forget that there's a slim risk of, the more the number, the risk, pregnancy associated risk that is across board. IVF, natural conception will be significant, will be increased to some extent.
Extent.
But again,
We're specialists now. We can deal with it.
thank you very much.
Um, so, can medications like birth control pills help to regulate the menstrual cycle in women with ovulatory disorders?
Yes. Birth control pills are very effective in management of ovulatory disorders, especially those caused by polycystic ovary syndrome. Yes, you remember we talked about the symptoms of irregular periods. Commonly, they can also have heavy periods, abnormal uterine bleeding. When you don't see your periods for a long time,
Time.
what happens is that the lining of the womb is shed every month. So a woman that doesn't see her period 3, 4 months, while everyone is shedding every month, it builds up.
Hmm.
So when she's shedding off, she sheds so much. So those you can also use the birth control pills to stop those excessive bleeding at different dose from what is used for birth control and also subsequently regularize her period.
You know, in our day and time, birth control has been seen as treatment for, or not necessarily treatments to use to stop conception and all of that. So it's like when you see a young girl with birth control pills, because of the society we live in, it's like What are you doing? Are you a wayward child and all of that? But this is educative. Now this is informing us that there are a lot of reasons why people would use birth control pills. It's not
That's a
necessarily because
whole
of.
lot of reasons. Birth control pills are just, they just come in handy for the gynecologists.
Thank you, ma. So, what is your general counsel to the public as regards our topic?
Well, I would say ovulatory disorders are common.
Yeah,
They are treatable, manageable. Treatment options varies depending on the cause, and with whatever your condition or your situation is, ovulatory disorders can be managed, and your goals can be easily achieved.
achieved.
So, no one should sit at home and say, "My case is hopeless. I don't menstruate every month." For every challenge you have as regards to ovulatory disorders, there's a solution to that problem. So look out for your healthcare provider, look out for your specialist, and whatever the problem is will be tackled. Thank you.
Thank you, ma. Thank you, viewers, for staying tuned. Like she said, ovulatory disorders are treatable and they can be managed. And we can do this for you at Alps Hospital. You don't have to die in pain. You don't have to die in your silence, wondering when will my period come next. And the likes. Come to Alps. There are solutions for you. There are a variety of treatment options for you. Thank you for staying tuned. Thank you for being here. Thank you for always coming back here. Would love to meet you again or be here with you again during our next live sessions. Have a wonderful day. Bye.
Bye. Thank